and welcome to Doctors on TV. I'm your host, Dr. Sarah Barba-Cabodil. And I can't wait to share today's episode with you dahil dito po sa ating programa will inspire and motivate you to make positive changes for your physical, mental, and emotional well-being. Pero bago po ang lahat, mga kasambahay, kayo po ay aming iniimbitahan na i-follow and subscribe ang aming mga social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions po and comments sa mga pages na yan. Kaya after liking and subscribing, i-share nyo na din po sa inyong mga friends and family. Dahil sa pagdating ng COVID-19 pandemic, ipinatupad po ang iba't ibang restrictions upang mapigilan ang pagkalat ng virus. At isa po sa mga sektor na lubhang apektado nito ay ang ating mga ospital, kung saan nalimitahan ng iba't ibang surgical procedures bilang pag-iingat. At isa po sa mga common surgical procedures bago dumating ang pandemya ay ang hepato-pancreato-biliary or HPB surgery na may kaugnayan po sa ating liver, pancreas, gallbladder, and bile ducts. Alamin po natin kung tumaas nga ba o bumaba ang mga nag-undergo ng HPB surgery sa ating bansa noong dumating ang COVID-19 pandemic.
Hepato derives from the Greek word hepar, meaning liver, and some of the most common digestive problems includes our liver, which is part of the hepato-pancreato-biliary system of our body. Speaking of this, due to COVID-19 pandemic, organ donation and liver transplant has been greatly affected worldwide. In fact, according to a study published by the United States National Library of Medicine, due to COVID-19 pandemic, the surgeries and organ transplantation related to hepato-pancreato-biliary, or HPB, have significantly decreased. Also, a higher risk of mortality and complications are reported to the patients suffering from COVID-19 after an HPB surgery.
It's very interesting to know about this, di ba mga kasambahay? And for deeper understanding about this, stay tuned. Doctors on TV will be right back. Welcome back to our show. Moving forward to our discussion, as we learned in Dose of Information segment a while ago, our topic is all about affecting millions of people around the world, yet it's often misunderstood and overlooked. And for us to be able to understand more this topic, we invited a special guest joining us today who is an esteemed expert in the field of hepatobiliary surgery and to share her wealth of knowledge in this specialty. Let us welcome Dr. Catherine Este, an HPB surgeon from MAKATI Medical Center. Good morning, Dr. Catherine, or should I call you Dr. Cathy instead?
Yes, good morning, Dr. Sarah.
Yeah, welcome to Doctors on TV.
Thank you for invitation. And I'm very happy to be here. Just for our audience to know what HPB surgeon means, it's hepato-pancreato-biliary surgery. So HPB, that's hepato-pancreato-biliary, which pertains to the liver, pancreas, the biliary tract, which also includes the gallbladder.
And it sounds complicated.
It is very complicated.
So that's the more reason that na dapat tumutok sa atin ng ating mga viewers. Okay, dahil napakaganda ng ating tatalakayin. And for better understanding, Dr. Catherine will help us today. So let's get started, Doc. Okay, so what is the hepatobiliary system in our body?
Well, the hepatobiliary system is composed of the liver, the gallbladder, and the biliary tract. So that usually is concerned with our digestive functions, and metabolism. Because yung liver, there are so many things that it can do for us. For example, I mentioned about metabolism. Metabolism meaning metabolism of carbohydrates, proteins, fats, alcohol, the toxins, drugs. So lahat po yan, filter sort of. That's what layman people would know and think that it is filtering mechanism because doon siya pinaprocess eh. Okay, parang siyang factory. It will process all these things that we eat, we ingest. And then it's also a factory for the synthesis of proteins, synthesis of clotting factors. So lahat po yan, trabaho yan ng liver. It has so many functions. Lastly, one of the more important things also is production of bile. So when the bile is actually produced in the liver, tapos dadaan lang siya dun sa biliary tract. That's why it's hepatobiliary. Magkadugtong talaga yan, hindi natin sila pwedeng hiwalayin. Yes. So ang liver para siyang puno, no? It has a lot of branches inside, and that composes the blood vessels and the biliary tree. The biliary tree is where the bile will flow into. Pag nagawa na ng liver yung bile, na-produce niya yung bile, dadaloy siya dun sa bile duct. From the bile duct, bababa siya sa bituka, it goes into the intestine, and then it starts its function as digestive juice to help in digestion.
Okay, very comprehensive yung inyong explanation, Doktora. And nakita natin ganun ka-importante talaga, ganun yung function nitong hepatobiliary system. Okay, so, and having mentioned that, Doktora, so what happens kapag diseases set in?
Yeah, so there are a lot of things. So, syempre, kalahati pa lang yung nasabi ko, hepatobiliary, may pancreas pa, no? But there's too much to tackle. We may be able to tackle it in a different time, but it's a combination of all these three organs that would help in our digestion. Okay, so let's move to just about the diseases of hepatobiliary first. Kapag hindi maganda yung function ng liver, patient will end up with liver failure. And bakit nagkakaroon ng liver failure? Dahil napapagod yung liver eh. Remember, the liver works to metabolize what we take in, what we drink, what we eat, everything. The liver will detoxify, will filter, whatever term that we use as we call it. And then, magtatrabaho pa siya, gagawin pa niya yung kailangan niyang i-produce, no? If the liver becomes too tired, kasi marami tayong iniinom na alcohol, so nakakasira yun ng atay. Meron tayong tinatawag na inflammation, yung pamamaga. So, ang ating liver cells magmamaga. After niya magmaga, syempre, mag-heal din siya, magkakaroon ng scarring. So once it goes through this inflammation, scarring, syempre, pag gumaling ang sugat, peklat. When there's peklat, that is when we call as fibrosis and leading to cirrhosis. And in the end, pag itong mga process na to, from a normal liver to fatty liver to fibrosis to cirrhosis, cancer can also set in. So yan yung process kung paano magkakaroon ng liver failure in the end when the patient develops cirrhosis and liver cancer. And on the other hand, yung bile naman kapag hindi balanse ang mga components ng bile, kasi meron yung bile pigments, merong cholesterol, merong water. Kapag itong tatlong components ito, pag hindi siya balance, ito na ang lagi nating naririnig, gallstones, bato sa abdo. So kapag magkaroon ka ng bato sa abdo, kailangan mo talagang maoperahan kasi maraming complications yan. When the stones become bigger and they obstruct the common bile duct, magkakaroon ng bato dun sa daanan, or bumagsak siya dun into the area of the intestine. So pwedeng magkaroon ng jaundice. Maninilaw ang pasyente, di ba? Magkakaroon ng infection, magkakalagnat, severe abdominal pain. So, eto na ang operation na kakailanganin ng pasyente. Kailangan matanggal yung abdo, matanggal yung bato, kung saan man siya nalaglag.
Okay. And Doktora, so this really sounds complicated, no? Basically, so na-mention nyo basically yung mga common diseases that affect the system. And having mentioned that, ano po yung most common mga signs and symptoms, okay, o yung namamanifest ng patients na nagkakaproblema sa system na ito?
Okay. So, most common, if it is gallstones, kasi yan naman yung most common eh. In fact, globally, worldwide, around 3 million surgeries of gallbladders are done every year.
Taas ng rate na
yes. And that's because there's really a high incidence of gallstones. Siyempre, sarap kumain, di ba? But anyway, when the patients have gallstones, number one, they would feel pain. Abdominal pain is the number one symptom. And then, kapag malala, nalaglag yung bato or nagkaroon ng infection, maninilaw ang pasyente, magkakalagnat. Pwede rin siya magsuka, pwede rin magkaroon ng encephalopathy, which means medyo nagiging confused na yung pasyente. Kung ganyan na yung situation, ibig sabihin malala na, matindi yung pagbabara nung daanan ng bile dahil sa bato. So, that's the most common symptoms, signs and symptoms that we see in patients with gallstones, which is the most common disease that we find amongst our patients. On the other hand, kapag mga liver cancer, liver cirrhosis, ganun din, they would also present with jaundice, panlalaki ng tiyan, yung tinatawag nating ascites, kasi naiipon yung tubig sa loob ng tiyan eh. So, in these cases, the patients can also have yung mga bruises, yung parang rashes, pero makati, tapos kakamutin nila, magdudugo-dugo. So, all of these can happen, no? But, kapag nangyari yan, usually medyo late na. In the beginning, it's silent. And that's the reason why it is scary, because silent something that does not have any alarm. So, silent siya, and once na-detect, it's a little bit too late. So, kaya talagang kailangan nating maalagaan ang ating atay and prevent all these things from happening. And of course, we need to have regular checkups.
Yeah, and Doctora, okay, you mentioned about checkups. So, apart from medical history taking and physical examination, what other diagnostic procedures do you usually request to come up with, your final diagnosis?
Yeah, of course, we need to know the clinical information. Napaka-importante po yun na tanungin ng maayos ang pasyente at bigyan nyo lahat ng information sa doktor. Ang mga nararamdaman ninyo, naranasan nyo, na bigyan ba kayo ng bakuna nung bata kayo, all of those information are important because part of the reasons why hepatitis, or should I say liver cirrhosis and liver cancer occurs is because of hepatitis B. Mataas ang incidence ng hepatitis B sa bansa natin. No? This is in Asia. And that's why we need to know kung meron bang history ng hepatitis B ang pasyente. Kapag may hepatitis B ang pasyente, very structured ang kanyang follow-up. With 3 to 6 months, dapat pina-follow up yan with regular ultrasound and blood test ng liver functions and tumor markers, which we call as AFP. And also a new one, which is we have already in the country, which is PIVCA2. Kapag kakailanganin yan, i-request yan ng mga doktor para malaman kung merong tumor ang liver or wala. So, bukod sa ultrasound, bukod sa clinical information, bukod sa ultrasound, bukod sa mga blood test, minsan or kadalasan actually, kakailanganin natin ng good quality triphasic CT scan. Yan po ay talagang dedicated for the liver para makita yung structure ng liver, yung dugo na dumadaloy, kung naapektuhan ba, at yung bile duct. So, yung CT scan, importante po yan para makita.
Doktora, sorry to cut. How different is triphasic CT scan from the rest of the CT scan which is available in many hospitals nationwide?
Yes. Ang CT scan pwede kasing non-contrast. So, kapag walang contrast, hindi po natin masyadong makikita yung mga bukol. It will not give us a very good information. So, pag triphasic, ibig sabihin 3 phase yan. Kasi, very unique to the liver is that ang liver, sinusuplayan ng 2 blood supply. Kaya tinatawag nating dual blood supply because there's the artery and the vein. And that's why it's triphasic because the blood goes into the liver, 25% of it goes into the liver through the hepatic artery, which is the arterial phase.
Yeah.
And 75% of the blood goes through the portal vein into the liver. And so, during the scan, that's the portovenous phase. And then, yung blood na nandun, nag-circulate sa loob ng liver, lalabas siya from the liver into the heart through the hepatic veins. Therefore, yung 3 phases na yun, makikita natin yung changes dun sa atay on the arterial phase, portovenous phase, and the hepatic phase.
So there is far better monitoring as compared to the usual CT scan.
Yes, more specific to the liver.
Okay, so yun, maganda yun. Ako, tandaan natin yan ha. So dapat talaga, pag kami mga nararamdaman din sa area po na yan, it's very important, it's very imperative that you go see your doctor, okay? Particularly itong ganitong specialization,
Specialist,
HPV surgeon. Okay, and ito, doktora, so we mentioned about surgery, no? What are the treatment options for this kind of diseases?
Liver, gallbladder, biliary, pancreas, these are solid organs. Pag solid organ, surgery talaga ang main. It's a gold standard. Okay? And prior to surgery, we really have to exhaust everything to make sure na tama yung diagnosis natin and magagawa natin siya ng proper treatment. So apart from CT scan, meron pa tayong iba. MRI, MRCP, maririnig nyo din yan. Meron pang PET-CT. So lahat po yan, available yan in Makati Med. So all of these things will be complementary. Kasi minsan, tanong yan ng pasyente lagi, ano bang mas better, CT scan or MRI?
Yeah.
Actually, it will really depend kung ano ang suspicion, kung ano ang problem ng pasyente. One is not better than the other, but they complement each other.
To provide different
They
benefits.
provide different information and give us the benefit of knowing what really is the problem of the patient. So we cannot immediately diagnose with just one particular type of scan. And that will give us, for example, CT scan or MRI will give us the roadmap. Kasi ang liver, ang biliary, very technical. As you've said this earlier, it's very technical. We need to know exactly saan ba tayo puputol. Alin ba ang kailangan nating tanggalin? Dahil ang liver, merong maraming segments, hindi lang po siya left or right. May segment 1, 2, 3, 4, 5, 6, 7, and 8. So which segment do we need to remove? And then within those segments, we have different blood vessels, different biliary tree, biliary tract. So lahat yan, pag nakita natin sa scan, which gives us a very good roadmap, no? Then we would be able to do a better surgery kasi meron na tayong guide. Para siyang GPS.
Saka, doktora, I'm sure you would want to be very conservative if you would want to conserve like a certain segment. You wouldn't touch that, no?
Definitely.
And I just wonder, how long does it take for you to finish, okay, itong isang surgical operation? On the average, doktora, how long does it take?
On the average, because we do most of our surgeries laparoscopically, so parang naglalaro ka ng video or kumakain ka with your chopsticks. So it takes much longer. So most of the time, it takes around 6 to 8 hours to finish our laparoscopic liver procedures. Pero kung gallstones, less than an hour, that's easy. But what's really important in these kinds of surgery is to avoid injury. Kasi the structures are very delicate, and once an injury occurs, for example, in your laparoscopic cholecystectomy, it's a very, very common procedure that's done every single day. Pero pag nagkaroon ng bile duct injury, the patient will be crippled forever because it's yung kanyang daanan ng bile, putol. Wala nang dadaanan.
That's why it takes longer talaga kasi para at least for you to be more careful, okay? And Doctora, you mentioned about several procedures, but what are the other most common surgical procedures when we talk about the hepatobiliary diseases?
Yan, yung laparoscopic cholecystectomy, which is the most common, and yung liver resections. And of course, for cirrhosis, na kailangan palitan yung buong liver, we'll have to do liver transplantation. Kasi wala nang other options eh.
The entire liver. Sorry, do you do that on a separate event? Not on the same schedule?
We schedule the patients, yes, of course. Liver transplant means that the liver is really not functioning anymore. Ito yung nagli-liver failure na ang pasyente. Kailangan ng palitan ng panibagong liver. So dapat meron siyang donor. It's either a living donor or what we call as a cadaveric donor, yung mga brain dead. So na willing sila mag-donate ng liver. So we get their liver, of course with permission. And then we'll have to do a lot of tests, of course, to make sure na mag-match. And then we have to implant it on the patient with cirrhosis who will be needing a new liver.
Pero ito, Doktora, without the transplant, usually how long yung recovery time of the patient from the surgery?
Liver transplant is a different type of surgery, of course. No, it's more complex. But for a regular hepatectomy, we call it hepatectomy, meaning part of the liver will be removed because of a tumor, then usually it's around 7 days, 5 to 7 days ang recovery time because it's laparoscopic. Kapag open, it can take up to 10 days, 7 to 10 days because malaki yung hiwa pag
Pero
open.
not too long din pala.
Hindi naman, yeah. We've mastered the procedure. We've been doing this every day for the past 20 years. So
I just imagine how good you are, Doctor.
It's something that we do all the time. Kaya before, they can take longer, but now the recovery is much faster. Kasi we have structured everything. Everything is according to our standard procedure. So we can do, our patients can recover within 5 to 7 days.
And siguro, Doctor, what conclusion can we arrive at with the conversation that we had in this episode?
Well, I think number one, we want patients to be more aware that the liver is really very important and prevention is key. Mas gusto naming mag-prevent kayo by living a healthy lifestyle rather than coming to see us in a very advanced stage. Kasi hindi na namin kayo masyadong matutulungan. Number two, kapag alam ninyo na meron kayong risk factors, ang ibig sabihin ng risk factors, hepatitis B, may alcohol, fatty liver, very common ang fatty liver these days. If you have all these risk factors, please come and see us so we can check you up, and then we need you to be monitored every 3 to 6 months para pag may problema, masusolusyonan natin kaagad.
Yeah,
diba?
Naku, this is really information overload, Doktora. And naku, ito mga kasambahay, there's more to come pa po, maya-maya po lamang. Naku, pansamantala muna po natin titigil ang ating talakayan. Kaya naku, huwag niyo ililipat ang channel, Doctors on TV. We'll be right back. At para pa rin po sa pagpapatuloy ng ating talakayan, still here with us is Dr. Catherine Este, an HPV surgeon from MAKATI Medical Center. Ito, Doktora, wait, na-mention nyo kanina yung parang, it's like GPS, so can you expound on that?
Yeah, so na-mention ko nga yung GPS kasi the scans, the CT scans, MRI, even the PET scans, they help us in our assessment, decision-making. Yeah. So, important yun na ma-decision natin kung ano yung dapat natin gawin, anong kind of surgery. As I've said, the liver has left side, right side, may mga segments. So, which part do we remove, no? But we need to be very accurate and precise during the surgery. So, nowadays, we do what we call as fluorescence-guided surgery. So, while operating, you will see that your liver will turn green. Okay? So, we inject a contrast, we inject a dye, and we will do some maneuvers during the surgery para yung liver na dapat matanggal, yun lang ang maiiwan na regular color, the whatever color that is. Tapos, ang tumor, magiging green. Yung tumor mismo, magiging green. Tapos, yung part na iiwan natin, let's say, gusto nating maiwan yung tumor, let's say, ito, yung tumor nasa malapit sa may gallbladder. Pag binigay natin yung dye a few days before, maiiwan yung kulay green dun It will always stay there. So, during the surgery, makita natin yung tumor na yun, kulay green. So, siya yung magsasabi sa atin, ito yung kailangan. Tanggalin mo na ako, please.
So, kung sino yung nag-fluoresce o kaya umilaw and may kulay doon, basically parang may marker.
May marker.
Yun lang siya.
Yes.
So, we avoid yung mga ibang pwedeng errors. Okay.
Yes.
But that's good kasi syempre, akala natin, sa pagkaka-explain niyo, Doktora, it sounds so simple, pero
Yeah.
I'm sure, pero when nakaharap ka na dun sa actual anatomical
Yes.
structures there, magkakamukha itsura di ba?
Kakamukha kasi
Yeah.
sila, lalo na sa cirrhosis. Bukol-bukol lahat yan. So, alin ang bukol doon? No? So, that's one of the problem. And also, kapag magtatanggal tayo ng part ng liver, iniiwasan kasi nating ma-devascularize, meaning mawalan ng dugo, yung supply ng dugo, yung part ng liver na maiiwan.
Yeah.
Kaya kailangan makita natin yung part na yun ay very, very green. Kapag very, very green siya, ibig sabihin, maganda pa yung supply dun sa part na yun. So, maiiwan siya. Yung part na hindi makulay, yun yung kailangan nating tanggalin.
So this technology is really of big
Oh yeah,
help,
definitely.
no?
Yes,
I mean, sa
definitely.
mga pasyente because talagang well-guided ang mga practitioners. Naku, doktora, and apart from this, ano pa yung mga advancement, okay, in managing this kind of patients surgically?
Yeah, in fact, I mentioned also laparoscopic cholecystectomy is the highest number of a surgical procedure in the world, no? And the most dreaded is bile duct injury. So using the same dye, yung fluorescence, it will also tell us where the bile duct is. Kapag nakita na natin yung bile duct ng kulay green, alam natin na dapat iwasan natin siya. So the surgeon will be able to remove the gallbladder only without injuring the bile duct, the common bile duct. Hindi po pwedeng putulin yung common bile duct. Lifeline yun eh. So when we use this kind of technology, it immediately shows us that the common bile duct is there, it is intact, and we know we're safe. So these kinds of technology become very, very crucial for us. And also, yung 3D imaging. So now we can operate 3D. Makita natin yung ating organs in a 3D fashion. We can also do them laparoscopically, which is more better for our patient's recovery kasi mas shorter ang recovery time. And of course, less pain. Tapos, lalo na sa babae, konti lang ang hiwa, maliliit lang. Yeah, so those are innovations and those are really made for the patient, keeping our patients in the center of the treatment process, what they want and what is most advantageous to them. So these will definitely help shorten the hospital stay. And anyway, in the end, magbabalance din yung cost because even if there's a little addition cost to the hospitalization, they get home early, they go back to work early. So it balances out.
Right away.
They can be very productive. We have patients who come in the morning, do a gallbladder surgery, go home in the afternoon, back to work the next day.
But that's
2 days
soon.
later. Yes. Yes.
The surgeon must be really, really good. And
We
Doctora, wait, how about the post-surgery care?
Post-surgery care is it really depends on what type of surgery. So for gallbladder surgeries, the care, as I've said, it can be just between 24 to 48 hours and patients can go back, do their routines, no? But it also depends on their pain threshold. If their pain threshold is low, yun, medyo mga 1 week pa siguro sila sa bahay, medyo may konting TLC muna. Pero kung wala naman siyang mataas ang pain threshold niya, some of these patients really go back to work immediately. And for liver, yun yung mas complicated because we still need to take care of the liver a lot. Even if they can go home in 5 to 7 days, but they would still have to recuperate at home with the right type of nutrition, with some light exercises, with very well hydration, TLC pa rin. So
I see. And the totality of the prognosis, Doctora?
if the patients can be operated on, that means they have a better prognosis. Patients whom we say hindi na pwedeng operasyon, gawa na lang natin ng ito, bigyan natin ng gamot, gawa natin ng other procedures, these have poorer prognosis. And that's why there's a joke in our clinic. Kapag sinabihan ka, minsan nagkukwentuhan yung mga pasyente.
Ay, parang kasi naghihintayan sila.
Yes, naghihintayan sila. So, merong mga natatakot ako, baka operahan ako ni doktora. So that was really a joke that has been going around in my clinic. Because if we say that you are a candidate for surgery, that means you are in a better position because you have a chance for cure.
Yeah, you still have hope there.
Yes, yes. But if we say, I'm sorry, I cannot help you and I won't be able to do surgery on you, then it means that it's a little bit more advanced, or because of technology, because of new developments, we now have new drugs as well. We have immunotherapy, targeted therapy that we can give to shrink the tumor. So sometimes it doesn't mean na kapag hindi kayo na-operahan kaagad, wala nang hope. Hindi naman. We can do some bridge. So meaning, bigyan muna natin ng gamot, paliitin muna natin, or palakasin natin ng pasyente, and then operahan natin
Just
siya.
a little delay.
Yes, it's just a little delayed.
Para lang at least mas kaya rin
Correct.
makapag-recuperate ng pasyente ng maayos.
Yes.
Pero doktora, in what instances or what contraindications usually ang kino-consider natin na hindi na po pwedeng operahan yung patient?
Very good, yes. That is something that we need to carefully calculate. Kasi maraming reasons yan. There are patient factors, and there are liver factors. Patient factor meaning may mga sakit sa puso or merong mga other problems, kidney problems, all of these. And if the tumor is too advanced, so let's say ang tumor ay originating from the liver, pero kumalat na sa lungs, kumalat sa ibang part, hindi na natin dapat operahan yun. No? So we will give them some other types of treatment. So those are the factors. There's the liver factor.
Doctor, sorry to cut. How about the age of the patient?
Age is just a number.
So, as long as the patient can,
As long as the patient is strong, medically fit, we do not deny the patient of surgery.
Despite the advancement in age,
Yes.
kahit matanda na.
We've operated on patient at 92 years old.
Oh.
Yes, yes. And they've lived another 8 years. Umabot pa ng 100, diba?
Oh.
Yeah, so age is just a number. But in these patients, we are very careful because we really want to make sure that we optimize their condition for the surgery. And it also depends on what type of surgery. If the surgery is extremely complex, then of course we have to step back and say, is it worth it? Because the risk is high, diba? So we need to know what the goals of the patients are, what the risk is. Everything has to be calculated very well. And that's why I said calculate. Then the liver. The liver plays an important role, especially for liver tumors, liver cancers that need to be operated on. Because a person can tolerate removal of liver up to 70%. So, kakalculate namin yan. It's a long process. We need to look at the scans. We have to do some 3D reconstruction. Calculate natin kung kapag tinanggal tong part na to, ilang percent na lang ang maiiwan. If we still have 30% in a normal liver, patient would be eligible. But if the patient is cirrhotic, functions are not so good, then we prefer to have at least 40% left. So we need to calculate this very well. Liver function is very crucial. Kasi kahit matanggal natin yung bukol, pangit naman yung liver function niya, magkakaroon siya ng complications.
Yeah. And usually, itong time duration, gano'ng time duration itong calculation and observation ng patient prior to surgery?
Usually, we try our best to give the patient a solution, a consensus, because we do a multidisciplinary meeting. Yes, we do consult all together, the radiologist, the oncologist, ourselves, the hepatologist. So we try to give the patients a solution within 3 to 4 weeks max. Okay, usually 2 weeks lang we would be able to come up with a solution.
Oh, and this is really a team that helps
It's a
the
team.
patient.
This is teamwork. Liver surgery, hepato-pancreato-biliary management of diseases is always a teamwork.
Oh, thank you very much, Doktora. I'm sure yung ating viewers maraming natutunan kasi I myself have learned a lot. Okay, that's information overload. Very comprehensive. Thank you very much for those generous inputs, Doktora. And baka meron kayong final words para sa ating mga viewers?
I think the most important really is self-care. Protect yourselves from hepatitis B, from toxins such as alcohol, smoking, eat well, sleep well, love much. So these are important so that we have a very good lifestyle, good habits, and prevent diseases because, stress is a risk factor too. So we need to make sure that we try to prevent the disease. And if we have risk factors such as hepatitis B already, or we have been intoxicated with alcohol, therefore we need to have regular checkups. And if you are diagnosed, do not be afraid because we have solutions. No matter what, we will find a way to help you go through this journey. Just make sure that you come to us, see us, talk to us, and we will definitely help you. There will always be a solution.
Very well said, Doctora. Thank you very much again. And please invite our viewers to visit you here at Makati Medical Center.
Yes, please. Please do see us at Makati Medical Center. We have a comprehensive team in our hepatobiliary pancreatic unit, composing of the surgeons, the HPB surgeons, our hepatologists, gastroenterologists, medical oncologists, radiologists, interventional radiologists, palliative care. Everyone is on board. And most importantly, we have all the things that you need, not only the equipment, but the people who truly care for you here at Makati Medical Center.
Okay, thank you very much again, Dr. Catherine Este, a hepatobiliary surgeon from Makati Medical Center. We hope mga kasambahay ay marami po kayong natutunan sa ating mga tinalakay kanina. Pero hindi pa po nagtatapos dyan. Let's add some knowledge para sa kalusugan ng mga bata. Because even them are prone to liver diseases. Let's watch Baby Talk.
Nagkakaroon ng liver failure kung ang atay ay nasira na at hindi na kayang gampanan ang trabaho nito sa ating katawan. Bagamat madalang pwedeng magkaroon ng liver failure ang mga bata at sanggol, ang tawag dito ay pediatric liver failure. Karamihan naman ay gumagaling pero may ibang malalang kondisyon kung saan kailangan na ng liver transplant para mabuhay ang pasyente. Ngunit ano nga ba ang mga palatandaan na dapat nating malaman mga mommies na kung ang ating anak ay dapat nang tumungo sa emergency room? Yan ang ating pag-uusapan ngayong araw. Ang atay or liver ang second largest organ sa ating katawan. Ito ay matatagpuan sa abdominal area at madami itong important na role sa ating katawan. Nagpo-produce sila ng proteins para sa blood clotting, delivery ng oxygen sa katawan at suporta sa immune system. Nagpo-produce din ang liver ng bile na kailangan sa pagtunaw ng pagkain. Tumutulong din ang liver na linisin ang mga toxins at harmful chemicals sa dugo. At tumutulong din sila sa pagkontrol ng asukal at kolesterol sa ating katawan. Ang liver failure sa bata, bihira itong nakikita pero delikado kapag ito ay nangyari. Ang liver failure ay tinatawag na acute kapag ang atay ng bata ay mabilis na humihina at hindi na kayang gumana normally. Ito ay nangyayari in a matter of days or weeks lang sa mga bata na walang previous history of liver disease. Ang acute liver failure ay isang medical emergency. Ang liver failure naman ay chronic kung ang pagkasira ng atay ay nangyayari over months or years. Ito ay dulot ng mga sakit sa atay na tulad ng biliary atresia, metabolic liver disease, hepatitis B, or hepatitis C, or liver cirrhosis. Ang mga symptoms ng liver failure ay pain or tenderness in the upper right part of the abdomen, panghihina or weakness, fatigue or madaling mapagod, nausea, pagsusuka, pangingitim ng ihi, easy bleeding, at mga small spider-like vessels visible sa balat. Ano nga bang mga palatandaan na ang liver failure ay isang emergency? Una, encephalopathy, kung saan ang brain ay affected na at ang bata ay balisa at disoriented. Pangalawa, jaundice or paninilaw ng balat at mata. Nariyan din ang bleeding problem kung saan hindi na tumitigil ang pagdurugo ng sugat. Pwede ring medical emergency na kung ang bata ay meron ng portal hypertension, ascites o ang pag-ipon ng fluid sa abdominal cavity, at hepatomegaly o ang pamamaga ng atay. Ang treatment sa liver failure in children ay kombinasyon ng paggamot sa sakit na nagdudulot ng liver failure, paggamot sa side effects, at liver transplant. Ang liver failure sa bata ay isang seryosong kondisyon at pwedeng mabilis ang paglala nito. Kung may bata na may symptom of liver failure, siya ay dapat dalhin kagad sa doktor or sa pinakamalapit na ospital. And that's it mga kasangbahay. Sana marami kayong natutunan sa araw na ito. As always, consult your pediatrician for your baby's health. Salamat for watching today's episode. Again, I'm Dr. Katrina Florcruz Dacanay. You may contact me through the following: Facebook, Dr. Katrina Florcruz, YouTube, Dr. Katrina Florcruz, at sa aking Instagram at TikTok accounts, katrinamd.ph. See you everyone in the next episode.
Hello mga kasambahay! For today's episode, pag-uusapan natin kung paano nga ba natin pangangalagaan ang ating liver. Alam niyo ba mga kasambahay na maraming sakit o komplikasyon ang maaaring mangyari sa katawan ng isang tao kung hindi mapapangalagaan ang kanilang liver? Ilan dito ay liver cirrhosis, fatty liver, hepatitis A, B, or C, at ang liver cancer. Kaya naman para maiwasan ang mga sakit na ito, magbibigay kami sa inyo ng ilang tips on how to keep our liver healthy naturally. Sinong mag-aakala na ang isa sa mga paborito nating inumin ay may mabuti palang epekto sa ating atay? Ayon sa pag-aaral, ang pag-inom ng organic rice coffee ay maaaring magpababa ng risk ng pagkakaroon ng liver cancer. Hindi lang ito brain enhancer at immunity booster, kundi ito din ay mayroong positibong epekto sa liver diseases at inflammation. Ang pag-inom ng organic rice coffee ay nagre-resulta ng pagkakaroon ng mataas na antioxidant level sa ating atay, habang pinapababa naman nito ang inflammation. Nilalabanan din ng mga antioxidants ang free radicals sa ating katawan na sumisira sa ating cells. Umiwas na rin po tayo sa mga inumin na may alkohol, pagkain ng red meat, mga pritong pagkain at mamantikang pagkain. Umiwas na rin po tayo sa sobrang matatamis at maaalat na pagkain, dahil lahat po ng sobra ay siguradong masama sa ating atay. Ugaliin po ang mag-ehersisyo araw-araw at ang pag-inom ng maraming tubig. Tandaan, naiisa lang ang ating liver, kaya mga kasambahay, pahalagahan natin ito. Kaya naman ingatan natin at huwag abusuhin. Sana ay marami kayong natutunan sa episode natin ngayong araw. See you again next week for more natural tips. Muli, ako si Jason Sanchez, your integrative medicine doctor. Please follow me on my social media accounts, DocJTV. Because natural is beautiful, only here at Naturally Yours.
Us to the end of today's enlightening episode. But before we say goodbye, I would like to greet my kambal, Iyo and Iya, Doc Alain, and of course si EJ. Happy birthday also to my BFF, Dr. Melanie Arante Llagas. And syempre, nanay and tatay, I miss and love you both. As we wrap up today's episode, we'd like to extend our gratitude to all our viewers for their continued support. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, maraming salamat po sa inyong lahat. Ito po si Dr. Sara Barba-Cabodil. Let's make it a habit to learn about good health, only here at Doctors on TV.
Watch these snippets for the upcoming episode on Sunday.
Thermalytics, it's the only one in the Philippines, and we're the only one, we're the only clinic that has access to this technology. And the technology, instead of using röntgen, which is X-ray, mammogram, instead of using sound waves, which is the ultrasound, we have the thermalytics that uses heat to create images. And the images are interpreted through the most intelligent and the best radiologists in the world. And her office is in the clouds. Ano ang pangalan niya? Artificial Intelligence.
We would like to thank MAKATI Medical Center, a hospital with a heart, located at Amarsal Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor, Ayala North Exchange Tower 1, Legazpi Village, Makati City. Adlaon Optical, located at ground floor Super 8 Warehouse, Poblacion, Baliwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Meycauayan City, Bulacan, 0922-861-2095. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360. Or you can email them at lgcsalesco@gmail.com. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikisa sa ating adhikain na may bahagi ang kaalamang pangkalusugan. Dr. Sara Barba-Cabodil would like to express her gratitude to Medical Depot. Healthy Nom Nom Food. Wearly Dough. Barba-Cabodil Health and Wellness Center, located at Unit 1531, Centuria Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sara Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center, Attorney Pilar Nenuca P. Almira, President and CEO, Dr. Saturnino P. Javier, Medical Director, Ms. Arlene L. Sanco, Senior Vice President, Ms. Monica Reyes Dizon, Assistant Vice President, Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.